Alright, so we'll be talking about clinical informatics and how it can make an impact on disease management. So first off, what is clinical informatics? Clinical informatics is using informatics and information technology in order to better the delivery of healthcare. Okay, and this is important because we're always looking for new ways to improve quality and provide better treatment for patients, especially those who suffer from a chronic illness. And we currently have the proper technologies in place to get there. So two of these technologies that really stick out are clinical decision support systems and also telehealth. So we'll run through both of them and examples. So clinical decision support systems are a function that are seen in an electronic health record, and pretty much what it'll do is, it gives the physician reminder functions and alerts in order to aid them in making a treatment plan for a patient. So we have a study. It was done on HIV patients who received ART treatment for their disease. Okay, so it was broken up into two groups. There was the group where the physician used a clinical decision support system, and another group where no clinical decision support was used. And it was found that throughout their treatments, when there was an issue with their treatment, such as when there was treatment failure with the ART. So when there was treatment failure with ART, the physician would receive a pop-up, a reminder function in the EHR, and this allowed them to make an adjustment in their treating. The other group did not receive those reminders because they weren't using a system, and it was actually found that 95% of the time they received the warning or the reminder that there was some sort of issue with the treatment, which is bettering their disease management, right? So the group that wasn't exposed to clinical decision support may have not captured this, this issue in the treatment. Okay, and then we move on to telehealth. So a good example of telehealth is seen in ALS patients. So as someone with ALS, as their disease progresses, they tend to lose the ability to breathe on their own. They have some respiratory failure. What happens is they use non-invasive ventilation. So when using non-invasive ventilation, it's very hard to adapt to on your own and follow the proper compliance. So a lot of times you have to go back and forth to the doctor's office and make sure you're using it right. But what this study did was they used telehealth, which means the patient will stay at home from the comfort of their own home instead of having to travel back and forth, which can be difficult for an ALS patient. So from the comfort of their own home, they were using the non-invasive ventilation while they were video chatting with their physician in order to make sure they're following it properly, leading to better quality of life. They're able to breathe on their own for the most part. So there's just two examples of how clinical informatics can improve disease management.